Dr. Scott, Dr. Clum, faculty, alumni, students, and friends of Life University. I have the distinct honor and privilege of delivering the first Gerard W. Clum Lasting Purpose Legacy Lecture, which is co-sponsored by the Integrative Health Policy Consortium. Today's presentation is the transformation from disease care to whole health care in the United States. I think you'll be somewhat intrigued and pleased by hearing some good news. Dr. Clum is a man of phenomenal accomplishments and great compassion. Jerry was a Palmer College chiropractic graduate in 1973. He was then a founding faculty member at Life Chiropractic College, which is now Life University, and the first president of Life Chiropractic College West, holding the office from January 1981 through January of 2011. Dr. Clum served on the board of directors as an officer of the Association of Chiropractic Colleges, the Council of Chiropractic Education, the International Chiropractors Association, the Foundation for Chiropractic Progress, and the Chiropractor Summit and World Federation of Chiropractic. Since retiring from the presidency of Life West as president emeritus, and he certainly has not retired, he accepted an appointment as presidential liaison for external affairs at Life University. He has also been appointed the director of the Octagon, which is a think tank sponsored by Life University. Dr. Clum also recently was named director of the newly formed Center of Compassion, Integrity, and Secular Ethics at Life University. In addition, he serves as a consultant and expert witness in matters related to chiropractic practice and care. He has been recognized as Chiropractor of the Year by the ICA, Man of the Year by Dynamic Chiropractic, and is one of the top 5 leaders of the chiropractic profession in a Dynamic Chiropractors Reader Poll. Dr. Clum was the 2014 recipient of the Lee Homeward Award of the Association of the History of Chiropractic. He has lectured throughout the world and has been recognized and honored for his efforts over the years by international, national, state, and local groups. Of all his accomplishments, if you asked him, he would likely tell you his most important titles are husband, father, and friend. When I first met Jerry, oh my goodness, so many years ago, he asked me a question. He said, "What's missing from medicine?" Because as an MD, I was used to the term medicine. So I said, "Okay, Jerry, what's missing?" He said, "Health." And boy, did that get me thinking. My training led me to pathology, diagnosis, symptoms, pathophysiology, treatment of diseases. But even though I knew that we were supposed to be counseling about optimal health and well-being, that was not completely on my radar screen at the time. Well, Jerry convinced me to the point where our focus needed to be health and well-being. What else is there? According to the Institute of Medicine Summit on Integrative Medicine and Health, and this is from the IOM, in 2009, the conclusion was that the disease-driven approach to care has resulted in spiraling costs, as well as a fragmented health system that is reactive and episodic, as well as inefficient and impersonal. Wow, 2009. What conditions are prevalent in the US? As you can see, anywhere from obesity, inactivity, smoking, diabetes, hypertension, heart disease, stroke, chronic lung disease, cancer, and arthritis. In some studies, up to 80% has been shown that these conditions are lifestyle factors. Well, there's something that we know And what if we just applied what we already know about what works for health promotion and prevention? Well, according to Albert Einstein, in the middle of difficulty lies opportunity. And I think IHBC, many groups, Life University, the chiropractic groups, have taken advantage of that. My view of healthcare over the past century is that we started out with traditional values and wisdom. It was spiritually based, holistic, whole person, and it was very much in tune to caring. What happened? It devolved, became scientific, reductionistic, and there was depersonalization. Then it devolved into a business approach. Cost effectiveness and profit rules the day, and that's still in effect in many areas. We've evolved to a healthcare system, medical industrial complex. Now we have developed depersonalization on a system level, but we're about to make a turn. We're about to go to whole person healthcare system and evolution. It's starting philosophically. It has caught the attention of virtually every stakeholder group. Now the implementation phase begins, and it's for the future generation to make sure it's embedded in the system. What's whole health? It involves not just the person, but the community, the nation, and the earth globally. And it's composed of the physical, emotional, intellectual, and spiritual being of a human being. Today, we have some major issues, as you're all well aware. We have polarization in our country. We're just coming to the end of a pandemic. It's been difficult for all of us. There's a mental health crisis. What we need is resilience, and this is what I call the 4 pillars of resilience. And we need to look at resilience from a standpoint of physical, mental, emotional, and spiritual. Each component needs close attention for us to be resilient human beings, stay positive, and maintain our well-being. Modern conventional medicine starts with the body rather than the soul, the mind rather than the heart. The soul and the heart are the doorways to healing and health of the body and mind. Now we can design for this approach and lead the way. Lessons from Dr. Clum were just phenomenal. I've always wanted to know what's the essence of a human being? What's the spark? And in conversations with Jerry, came to the realization that he was working with the concept of vitalism. Chiropractic as a system of healing and Life University's educational and clinical philosophy is based on vitalism, a recognition that the universe itself is self-conscious, and as such, creates itself as a dynamic system wherein living organisms are self-developing, self-maintaining, and self-healing. Life's University ethos. We acknowledge that the phenomenon of life is fundamentally original, adaptable, and unpredictable. It is original in that life creates its own meaning, adaptable in that it expresses itself through overcoming entropy, and unpredictable as it transforms itself and evolves. The concept of vitalism is foundational to the entire concepts of health and wellness in humans. We are physiologically adapted to express health and well-being. Well, I had the privilege of attending an Octagon conference in 2013 on this very topic, where this was an evolution. And it was just thrilling to take part in such a frank, open, honest discussion, which led to the foregoing discussion of vitalism. According to Atul Gawande, We've been wrong about what our job is in medicine. We think our job is to ensure health and survival, but really it is larger than that. It is to enable well-being, and well-being is about the reasons one wishes to be alive. Those reasons matter not just at the end of life or when disability comes, but all along the way. Well, let me tell you a bit about the Integrative Health Policy Consortium and how influential Jerry was in its development, evolution, and accomplishments thus far. We came up with a definition for integrative health, which has been ratified by 3 or 4 of the major organizations. Integrative health is a collaborative, comprehensive, person-centered approach to health creation and disease care that addresses all factors impacting health, including social determinants, and embraces all evidence-informed disciplines, both conventional and complementary, in order to achieve optimal health and well-being. Our vision is that we envision a world with no barriers to health. And that has to do with access, environmental concerns, socioeconomic, inborn, behavioral, spiritual, etc. And the mission is we work to eliminate barriers to health. Very simple. We're a broad coalition of diverse healthcare professional organizations and their members. We're provider associations, academic institutions, scientists, thought leaders, public and community, health, advocacy, consumers, and coalitions. Advocates, we advocate for a pluralistic public policy and community action that creates health, ensures all Americans access to safe, high quality, integrative, whole person healthcare, and the foundations of health. Integrative health includes integrative health and medicine professionals, organizations, and approaches engaged in a collaborative to transform the future of healthcare delivery to health creation, prevention, and well-being. And according to Helen Keller, alone we can do so little, together we can do so much. And boy, has that borne true since I've been with IHBC. We're made up of over 25 organizations at this time. For your information, we have 4 chiropractic colleges and the ICA as Partners for Health members. And my goodness, this was years ago that I was involved with this with Senator Tom Harkin and Bernie Sanders and Barbara Mikulski in developing these 7 areas, which are actually part of the Affordable Care Act, and some of which still need some work, especially Section 2706, which has to do with non-discrimination and reimbursement for those professions that are licensed and evidence-informed. Well, look at this. We had a Congressional Integrative Health and Wellness Caucus, which we developed through IHBC in 2017. And in March of 2018, we had a seminal event. It was a congressional briefing held in the Rayburn building, which really did help make a difference going forward. And look at the tagline, Jerry. What's missing from medicine? Health. Thank you, Gerald Clum. Jerry also, by the way, was influential in having, I wrote a textbook called The Scientific Basis of Integrative Medicine. And after speaking to Jerry, he convinced me. It took me a while to convince my publisher to change the title, but my 3rd edition was The Scientific Basis of Integrative Health. Thank you again, Jerry. This Congressional Caucus was presented by Jerry, who did a marvelous job. I'll be showing you a few slides of his. Dr. Ben Kliegler, who was the director of the Veterans Administration Whole Health Program. That's Dr. Schumacher to his left, who is the former Surgeon General of the Army, who was he was very influential in having integrative health into into our military, and several others who are extremely well versed in integrative health and the movement toward whole health. This is the gathering, as you can see. Dr. Clum, there's Dr. Steve Welsh with a big smile on the left. And this was a wonderful gathering at that briefing. This is Dr. Clum's, this is an excerpt of Dr. Clum's presentation at that briefing, which I don't think he realizes was very impactful to a lot of the staffers and lawmakers. The gap is killing us. The gap between the creation of knowledge and its application in practice, policy, payment, and perspective in healthcare is harming our population and reducing the efficiency of the nation. Government plays a central role in extending as well as minimizing the gap in translation and implementation. The shifts from treatment of infectious disease to management of chronic conditions, from provider dominance to lifestyle and genetic power, from a passive patient to an empowered partner, from fix to prevent. Mind the gap, increase the budget of the National Center for Complementary Integrative Health to fund the comparative research and systematic reviews needed for broader acceptance of integrative care, address the restriction inherent in Medicare related to payment of various forms of integrative care, encourage the full implementation of non-pharmacologic approaches to pain management. I don't think Dr. Clum realizes how impactful this very presentation was in creating some changes. Medicare now covers acupuncture and obviously a few of the other disciplines, but this really helped lead to the coverage of acupuncture and low back pain. Expand active duty military and veterans access to integrative healthcare delivered by providers with expertise in the various disciplines. And we now have the whole health program, which was an evolution and has been markedly expanded in funding by the Congressional Oversight Committee of the Veterans Administration. Appreciate and respect the feedback that consumers expressed in the National Health Information Survey related to complementary care, chiropractic care, and its impact on health and well-being, and support and implement the spirit and intent of Section 2706 of the Patient Protection and Affordable Care Act. Thank you, Jerry. Thank you. Well, according to Dr. Charles Mayo, many, many years ago, it is a poor government that does not realize that the prolonged life, health, and happiness of its people are its greatest asset. Well, several years ago, the World Health Organization developed the social determinants of health. And now it is truly taking hold in our healthcare system. And that has to do with the fact that health is what it's about. And has to do with anything from economic stability, neighborhood and the physical environment, education, food, community, and the healthcare system in general. As a matter of fact, there's now launched a Congressional Social Determinants of Health Caucus. This was started by Representative Sherry Bustos, and there are several bills in Congress promoting the utilization of the social determinants in many various capacities. According to the Jonathan Perlin, the former director of the American Hospital Association. We have been honed to focus on sick care. It is a tough transition, but we have to learn to move from sick care to health care. And then there's the Veterans Administration Whole Health Program. It's here, it's alive, and from an initial pilot project, it's now being spread throughout the whole VA system, who is our largest healthcare provider in the United States. What's the approach? Whole health is an approach to healthcare that empowers and equips people to take charge of their health and well-being and to live their life to the fullest. It's an excellent program, and I think it'll serve for a model for other stakeholders in the healthcare system. IHPC conducted a congressional briefing by Dr. Helen Langevin, who gave a layout basically of the strategic plan for 2021 to 2026. And what's it about? Whole person health. Mapping a strategic vision for NCCIH. By the way, Jerry, I don't think you realize, but you were influential in, you were one of a voice helping to make a change in the name from the National Center for Complementary and Alternative Medicine into Complementary and Integrative Health. She is quite a proponent of whole person health, although I prefer the term whole health because, again, I think that the community and the nation needs to be included in our approach as well, given the social determinants. However, she is a true crusader, and we're seeing that research throughout NIH in the various institutes, not just NCCIH, is being influenced to look at a whole person health approach. An institute was created some years ago by Alice Walton, and this is really very important because the medical school is being developed by them, which will be a whole person medical school. How privileged we are. Imagine a day when the job of healthcare is to help people explore, discover, and reconnect to their purpose, their aspiration, their joy. And then we work together to strengthen one's health and healing to live one's fullest life. According to the Dalai Lama, if you want others to be happy, practice compassion. If you want to be happy, practice compassion. I think Jerry took this to heart because he developed the Center for Compassion, Integrity, and Secular Ethics at Life University. What a beautiful, incredible legacy. Let me read the inscription because this is what is sorely needed in the world today. We believe that a compassionate world is a peaceful world. We believe that a compassionate world is possible when every man, woman, and child treats others as they wish to be treated, with dignity, equity, and respect. We believe that all human beings are born with the capacity for compassion, and that it must be cultivated for human beings to survive and thrive. Thank you, Dr. Jerry Clum. Albert Schweitzer agrees with you. The purpose of human life is to serve and to show compassion and will to help others. Jerry, thank you for your wise counsel, generosity of spirit, humor, and cherished friendship. God bless you, my friend, and thank you all.